Yeah.
Just a little bit.
Yeah. No, the way he did it was
Porter County
very good.
Department.
Good job. He did a really good job.
Yeah. Are we?
So I got this awesome thing tonight. I'm going to record the meeting, and it actually summarizes the whole meeting, like actual Cliff's notes, the whole thing. It's awesome. So it transcribes it, and it can like. It works perfectly. Like it's 95% accurate in my book.
So do you use that at work?
I don't, not with my patients because it's not HIPAA compliant, but like with all my meetings that I do with like managers, meetings, my district meetings, I have like many hats that I wear. Well, after today, yeah, I'm actually gonna send it to Demetrius. I'm gonna basically make his life because the notes minutes will be this.
Yeah, that's like. Thank you for coming. So that's one of those initiatives.
2 minute warning, doctor.
Thank
We're gonna
you.
talk like thank God for miles.
Absolutely, I know, but I mean it's gonna destroy us someday. But whatever. In the meantime, I'm gonna use it.
I mean, it has to be approved by you guys. Then, and then we take it next week, and then the week after we at council because there's a junior salary associated. So, so that's a lot of what was.
I was reading that. So that's something he can do with our budget, but then the commissioners have to approve that.
As budgetary, the council has to approve
Okay.
it. The commissioners have to approve the job description
Oh, okay.
because they're the firing people in the county.
Okay.
So I know the whole
Communication specialist.
That's what both.
right,
Okay.
the whole delegation of responsibility is. It gets really confusing.
I know as I was reading.
Does the IT for meetings.
How many are, does it?
Past few days have been a nightmare.
Yeah, exactly.
The respiratory illness is going around like crazy. I mean, it's
I
just
don't want to
ridiculous.
I don't want
And we're gonna introduce all
plan.
staff. Well, except for Chris's husband,
Why is that?
and then sheriff.
Not a time to be.
He's sitting
No.
right. Talk to him.
But I'm gonna tell you, like, my clinic, Sunday I worked urgent care.
She's the ninny.
I saw 37. Monday, my clinic, 30. Today was my short day. I still saw 20 on my short day. Like, it's just,
Oh, she has plenty. She's probably the only one that I know people working.
Really? I just didn't wear it today.
I'm getting there. Like literally my desktop.
No,
I have never with
I
like
know.
a couple notes potentially open for whatever reason. Right now I'm sitting on probably 20 notes.
Because he teaches
First for me.
something there. So he came and spoke at the public health. He's in public health right now. So he went like introduced.
Is he doing minority affairs?
And that's what I'm gonna do. Like,
Yeah,
I don't know
like
if I'm
health
gonna be done.
equity or
At this tonight,
yeah.
like I can't go back and problem.
Yeah.
Yeah.
The bitches have been
No, he's
turning
great.
around.
No. Yeah, with his yucky.
ER. Yeah, we are. It's gonna be power self. Stupid.
And Carolyn's telling me she doesn't want to be a dancer.
Yeah, absolutely. Well, I mean,
Like, can you
there's been a lot
talk
of confusion with the whole like community health system versus community health.
It never ends.
Health. Like I think they're trying to
Got it.
themselves from that bullshit.
But it's like we were here.
All right, we are
I-
at 5:30.
but, like-
Can all please stand for the Pledge of Allegiance?
The order.
I pledge allegiance to the flag of the United States of America
and to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This is the Porter County Department.
So we're on a bit of a skeleton crew this evening. Thank you all for joining us. Mr. Hollenbeck had a conflict, so we have Attorney Barkus, Colby Barkus, here in his place. We appreciate you joining us. And Terry is stuck on a delayed flight. She's somewhere in the skies right now. And Dr. Fleming will be joining us, but was a little backed up with patients today. And Kathy's still out of town. But we have enough to proceed, so we shall do so. Did everyone have a chance to review the minutes? If everyone agrees,
Motion
we can.
to approve.
Thank you. You read my mind.
Second.
Okay, Dr. Boxer,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming.
Not here.
I'm sorry.
He's delinquent.
Robin,
Yes.
Dr. Rossum.
Yes.
Thank you, everyone.
Thank you. For our next board meeting will be on April 2nd, same place, same time. And then we'll move on to new business. If you can look further ahead on the agenda, we have a guest. Sheriff Ballin is here to speak. So I was going to move him up if everyone's okay so that he can start off and be ready to enjoy your evening.
Watch the Purdue game.
Yeah, watch the Purdue game. I know that.
Have to be loyal to my daughter.
Well, thank you for joining us.
Good evening.
Good evening.
Thank you. Okay, where do I begin? Just start?
Well, yeah, Sheriff Ballin is here to propose some funding that he was requesting for his wellness program, correct? And we just would like to hear more about that. So
Okay, all right. Good evening. How much time do I have?
as much.
Because you know I can talk. Well, first off, I want to say thank you for allowing me to come before you guys. I think since taking office, I hope that I've been able to relay how important mental health and substance dependency is to me and my organization. So one of the things that we've really focused on is also the mental health component, both outside the agency and within the agency. What I'm specifically here for tonight is to request funding for mental health within the organization, okay? And other, what I would say, public safety entities around the county. So when I was the chief at Valpo, I had contracted Dr. Dennis Shelby, who's a psychoanalyst, for consultation. And he had such a large impact for the mental health of the officers that I feel like this is something that, upon taking the position of sheriff, that we could really make a difference around the county. They say that the average person deals with 4 to 6 critical incidences or traumatic incidences in their life, where public safety deals with that per month, okay, between fatalities and critical incidences. So it's important that if we expect our public safety personnel to help people that are dealing with the most critical times in their life, that we make sure that they're okay as well. And that includes not just police officers, that's fire personnel, that's EMS, EMT, EMA, anybody that's deemed public safety or first responders. So what I wanted to do is, with Dr. Dennis Shelby, and a little bit on his background, he is a psychoanalyst. He deals with soldiers and first responders with PTSD. What he also is that makes him really a connectability to public safety is that he was a 13-year reserve police officer for the Porter County Sheriff's Department. All right, and he was highly recommended by mental health professionals throughout Valpo when I first decided to do this at Valpo PD. And it's important that our public safety people are able to relate and connect. And I feel that Dr. Shelby can also bridge that gap because there's a very prideful profession. And what I feel is EAPs don't make that bridge. Okay, it takes a lot to call somebody on the phone that you don't know and say, I'm really struggling with X, Y, or Z, okay? And I don't want to take that chance, okay, when it comes to public safety. So Dr. Shelby has also graciously agreed to be a consultant for the Porter County Sheriff's Department for $10,000 a year. And I feel like that's a small price to pay, and I feel like we can also extend that out to all public safety. Now, when I first told him that, he kind of gave me an eyebrow raise, all right? All of public safety, but I think, what's nice is he's willing to try that and make sure and see how it goes.
Does he realize what he's getting into?
I think he does.
Okay.
Right? I really do. And I think the biggest thing, too, is also that we market this to all of public safety in the county, right? And that also includes like debriefs and things like that. And one thing that we've been able to focus on is I feel that the Sheriff's Office has a very strong wellness program internally. Okay, what we've been able to do over the past year is we were able to use half of the old 911 dispatch center, the office portion, and I brought our programs director from within the jail into that area. I brought my police social worker into that area. Okay, I brought North Shore. I brought all these entities that really kind of run all over the sheriff's office and in the jail on a daily basis. And we brought them together, and they communicate every single day. And now that we were able to get some funding for an additional police social worker that's going to focus primarily on prevention and recovery, okay, that's also going to just expand this even more. And I feel like bringing Dr. Shelby into the mix is really just makes it, I feel, full circle. And I think this is really going to make a difference. And if the funding is granted, we're going to hit the ground running. And I'm going to reach out to all the public safety entities within the county and make sure that they're aware of what's going on. And leave the rest up to Dr. Shelby. And so with Dr. Shelby, what my primary focus is it's confidential, okay, with the public safety entities, okay. So what I've asked Dr. Shelby is, look, and you work with them, you give them some sessions and help guide them to the direction that they need, whether it's through personal relationship issues that they're having within the home. I mean, we're all human beings, so we all struggle with that. Or whether it's the PTSD type situation. Hopefully, it's never a substance dependency issue, but I think in the event that there's injuries, we have to be very careful, especially with public safety, where they suffer from back, knee injuries like that. We have to monitor that very well. And I think as long as we were able to build that relationship between the public safety personnel and Dr. Shelby, hopefully we could prevent any type of substance dependency developments. So, those are things that are very important to me, and that's why I've come. I presented that in a written form, and I'm asking for funding for that for this year. And I will answer any questions that you guys might have.
Actually, I do have a question. Like, how do you envision it's going to work? He'll have like a phone number that will be given to the county employees that can call him at any time to request
Yes.
time with him.
Yep.
He's
And-
been providing that
Yeah.
service.
He's already
out
been doing it.
thing.
Wow.
Yeah.
Okay.
He started this last year.
All right.
And we refer people to him all the time.
Yeah.
And-
So I will tell you personally, in our industry, in the healthcare industry, we have a very similar issue in the sense that any sort of admittance of mental health, substance abuse turns into potentially you lose your career. And I can imagine that it's the same exact thing for your fellow pupils. So I find this to be an incredible asset to your profession. So absolutely, this is necessary.
Thank you.
Carrie and I had the opportunity to meet with Sheriff Allen and Dr. Shelby, and I can't speak enough as to how impressive the plan and the commitment in terms of all of this was. It is a change of mind frame. He and I had both spoke, I'm sure you as well, like to acknowledge this. I mean,
Right. Absolutely.
we've seen traumas and no one
Right.
debriefed us, and to acknowledge that this is important and this is something that is integral in their well-being. And he has a further plan further than this. It's a several-year plan to expand upon this even more so. This is just the beginning steps of things, but very innovative and very important.
I mean, the public's well-being depends on their well-being.
Exactly. And there was another officer in with our meeting, and he was describing how, they really appreciate how this person knows and understands what they've been through. He's been part of this system. And so that makes a difference as opposed to calling an EAP number and getting someone, like he said, that you've never spoken to, have no relationship. So this is great. Fantastic. I applaud you.
Thank you.
Sheriff, I have a question.
Yeah.
The numbers involved. Do you have an idea as to how many, I probably should know that, how many first responders we have within Porter County? How many, I know you know how many are in your organization, but that might help what our dollars are reaching, help us understand that.
A few hundred between police, fire,
911.
911, and that's why I want to include these entities that maybe not only respond to the scene, but, with 911, they're the ones on the phone dealing with, try to talk someone off the ledge, so to speak, and or the officers asking for assistance, So it's important that we include everybody that's part of that. So it's a couple hundred.
And I think turnover at 911, part of that, the issue there is I think their stress gets a little bit overlooked, or they push it under the rug, or it's,
Yeah, I can't comment on that.
Yeah,
Director
right,
Gunn's
But-
wheelhouse on that one. Yeah.
Out of curiosity, will this also reach to the unincorporated areas? For example, I live in Morgan County, and I know that just our volunteer fire department's 20
Yes.
strong.
Yeah, I want to make it available to all
Okay.
public safety entities.
great.
Yeah, and I think if you publicize that as well, that, you know, we're trying to destigmatize
Exactly.
this from the bottom up and the top down, however we can, and to say that folks who are really tasked with the safety and security of everybody in Porter County, they are stepping up, they are taking care of themselves, they are reducing burnout, they are doing the very things that we want the people in our community to model, you know? And I'm really so excited that you're doing this, because I am a mental health provider, and I know we have months-long waiting lists that are just really, you know, bad to have wait for months. And so if somebody has a number that they can call right away and provide services and meet that need in the moment, I'm really excited. Thank you.
Oh, yeah, absolutely. Well, you know, being around public safety as long as I have, since 1992, and we've talked about this in a meeting. I mean, to see the paradigm shift from not acknowledging it or hiding it away or pushing it away and saying it's to where we are today, I think all it's doing is making our society better. Yeah.
So let me ask this question. So what are we looking at? I know that it was put on paper, but to have it on,
Yeah.
what are we looking at as an ask from public health?
10,000
10,000 only?
this year, yeah.
Right now.
Part of your
Yeah.
budget for coming years, a more comprehensive
So
budget.
just 10,000 straight
For
for a
us,
doctor? That's it?
Yes.
Oh, that's cheap.
Right now, Dr. Shelby might be, right, and then that's why, you know, we may have to adjust that depending on how it evolves,
Absolutely.
but right now for 2024, that's what we're looking at.
All right.
Thank you.
Thank you.
Okay, yeah.
Thank you for your service.
Yep.
You.
So if we can have a motion to approve Sheriff Ballin's proposal for funding towards their wellness
Motion
program,
approved.
specifically the mental health.
Have to get it out.
Dr. Boxon?
Yes.
Dr. Brunt?
Yes.
Robin?
Yes.
Dr. Osun?
Absolutely.
Okay, thank you, board.
Thank you.
Thank you for all that you do.
Thank you.
All right, so we'll go get back on track to number 4, new business, if anyone has any new business. Old business. All right. Report of board attorney.
Well, we have a health officer administrative position, and I was actually going to refer
To me. Yeah.
to Ms. Boxham.
Thank
Dr.
you.
Boxham with regard to that position.
So as we know, Dr. Stamp has put in her intent to retire sometime this year. And so that will require us to put out the position of health officer. And in doing so, we kind of had to revamp it a little bit. Since she started and where we are now, the duties of the health officer have certainly expanded. We have been fortunate is an understatement to have Dr. Stamp give of her time in the way that she has over the course of the last few years, but that really hasn't been delineated in her contract in terms of the benefits for the amount of time that's put in. So we have, over the course of the last few months, kind of redeveloped the position for the health officer and created this new position description that was sent to all of us last month to review. And so at this time, we will need to approve this description of position so that we can then forward this on to the county council and the county commissioners, and they would be able to approve this change of the description of the position. One of the things that I just kind of wanted to touch upon, I don't even know what is your time even described? It's not part-time even, is, no,
Right. I think technically it's part-time, but
Yeah.
it has no, so the health officer position is an appointed position. It has no hours assigned to it. It is what the county needs. So that has been part-time. It has varied from an hour a week to full-time, depending on what's been going on in the county. And along with that, as an appointed position, it has never had a job description. So we are not changing a job description. We are creating a job description for this position. And over time, so I'm in my 13th year, 12th or 13th year here. Over time, the duties of the health officer have just expanded. And there has been more interest in having the health officer involved in the community and reaching out to business groups and service groups and members of the community and messaging and all sorts of things along those lines. And there has been more internal, it has just grown to be a little bit more as more of a management position than it had been, just almost in a, not technically, but almost an advisory position in the past. So in a county of 177 some thousand people, it is possible that it could support a full-time position.
Yeah. So we kind of wanted to create a description that would allow this position to expand in the way that it probably needs to do so. And get, we don't know what kind of applicants we're going to get, but that gives us the opening to be able to allow a full-time position if we have an applicant that can maybe only do part-time. We have to see what we get. We don't know what we're going to get, but we wanted to be able to have a description that would allow for the fullest capabilities of a full-time position with the benefits that go along with that. And then, the new health officer can also have the capabilities of expanding this in the way he or she chooses to do so, including, we did field trips to other health, to other health departments. Some do patient care and bill for services. We have residency programs now that we can precept and do things of that nature with. So that was kind of where that all came from. I don't know if any other questions. Yeah.
I think in that regard, after reviewing this and running it by other physicians in the state or in the region, it just makes it more applicable, more desirable, because you really do have to, for somebody in private practice to adjust, or somebody that's determining on their flexibility, which today flexibility, it's just to retain, to keep, to get more people. That's what I liked about it. And those that were interested seemed more interested still. It just makes that a better opportunity to hopefully recruit a good candidate.
Yes.
Either through some of the programs, the residencies these days do guide post-study in the management aspects of the way everything is growing in the country. So that's why I liked it.
A couple quick comments. First of all, love it. I love the idea that we are actually making that job description. As a physician myself, I will tell you a couple things that concern me. One, I think that offering yourself part-time on a whenever I'm needed basis is difficult because of the flexibility issue Dr. Fleming was talking about. So potentially we're going to have to address that, because there is, like, for example, I thought about myself, like if I were to apply to this position, the question would be, how is this going to affect my ability to practice myself? And, not many people, are going to be able to just say, okay, whenever you need me, I'm there, because it's difficult as a part-time job to just get up and go when needed. And I would say that not everybody has been as magnanimous as our previous person to be able to offer that kind of
So true.
position standpoint.
Yeah.
So I worry about that and the quality of the candidate we're going to get because of not kind of delineating what the requirement is there. Only other comment I would make, and I would want to remove this working knowledge of the standard English grammar, spelling, and punctuation. I mean, if you're able to pass the United States medical licensing exam, get board certified in the state of Indiana to practice medicine, and can't speak English, I think that's kind of redundant. So potentially maybe we remove that. But short of that, that's my only concern here.
I'm happy to shorten this. Pages is quite a lot.
Right.
So when we were putting this together, we took examples from, there was an example from the IPHA. There were examples from, for instance, Monroe County, Vandenberg County. Those were the main ones I looked at. I think there was another one I looked at, and I kind of pulled things that I thought were applicable to our county and what I have been doing, things that I, could see happening in the future. Of course, the new health officer is going to have a vision for what they, feel is programming should look like. So there could be changes that way. But they all kind of had this wording in it to include like office equipment. One said using a telephone. I'm like, are you kidding me?
Yeah.
So I wasn't quite sure which ones to put in there, and is that just a
That
basic
standard.
thing that we
Yeah.
do?
Right.
Right. I am not an HR person, so those are kind of just how we work. So we certainly can remove some of these.
I like the length of description, because if somebody's interested, I want them to understand what they're getting into.
Yes.
And that it's clear and they want to stay. That's the challenge anymore, is after a year or two, people start saying, well, I expected, or I wanted, or I anticipated. No, this is what you signed up for. You're a doctor.
Right, exactly. And I wanted to make sure that it was very identifiable right up front, that this is a 4-year term
Yes.
you're being appointed to.
Yes.
Yeah,
Exactly.
I was gonna say, it has to be
Four-
clear, right? The expectation is that it's 4 years.
4 years. It's a full
Right.
appointment. Yeah.
Renewable,
Yeah.
of course,
Right.
on the,
Because otherwise it could be a revolving door.
So maybe one of the things potentially you can add to this is, because you have that experience, Dr. Stamp, is potentially how much you dedicated to the position outside of your regular job, and what you needed to basically bring bread home to the family, essentially. Because I think that might be the hurdle that we're going to have to
Right.
step with finding somebody.
So my situation had been such that when I came to Valparaiso 13 years ago, I had 4 very young children. I was not interested in a full-time traditional family medicine position, so I took a 0.5 FTE, a half-time position in a clinic, and was looking for just something a little bit interesting, a little bit more. This actually, fell in my lap effectively. With me having run into Dr. Babcock at an urgent care shift, and he really encouraged me to apply. So the two positions really they balanced for me professionally. They balanced my career out nicely.
Do you think if you were full-time, you could have handled it?
That's a really good question.
Not now.
I don't think so. I think very honestly,
That's exactly what I'm asking.
that's right.
Not now.
Very honestly, I think this would be difficult to do in your 1 day off a week.
That's what I'm asking.
Really, when Dr. Babcock was health officer, he was full-time for most of it. I mean, he was here for 34 years, but the job was very different, and it was all basically done by fax. And he could handle pretty much anything that needed to be done from his office in between patients. So that just is not the way this job works anymore.
Especially with this new funding and all the
Right.
development. I mean, I'm just doing this with the board.
I think it can-
amount of time. I don't. What they do is completely
because I mean, we're doing this pro bono. I mean, we don't get paid to be on the board, and this already, you know, is conflicting with a lot of things for me. So just this little bit of a commitment, let alone that kind of commitment. So I just worry about like the requirement of that position with the amount of funding that they're going to be able to get, and the expectation, like potentially we have to say you're a part-time physician to be able to get this job, because I can't see a full-time physician taking this position.
I think, people physicians kind of come at this in their careers at different times of
Right.
life. The St. Joseph County Health Officer is a full-time position. It is not a clinical position, so she does not see patients. But she took the position from, she was a hospitalist and had young children, and she was interested in having a time of her life where she was in a traditional office setting and had her weekends and that kind of thing. So she was willing to take that pay cut and take that little bit of the clinical thing for the time being and set that aside. So, and then, so potentially there could be people who are working part-time and would like to take this on as part-time. There are people who are newly retired that would not want a full-time commitment, but as a part-time, 20 hours, I think this job could be done in 20 hours. If we wanted to expand, though, to clinical services, I think we'd really be looking at full-time.
So, even with part-time, would they get benefits for that, or?
The county has always offered me benefits, even with this, unusual situation as far as part-time goes with no hours attached to it. So I've never had to take the benefits. But as you look at the funding that we're going to be putting forth, if you would like us to do this, Carrie and I will take it to the commissioners and then take it to the council, because funding will need to be reappropriated for up to that full-time amount. You'll see that we have to work in benefits as part of that, have that funding appropriated and available for whoever would
I mean,
take.
that might be just a added bonus.
I think that's a requirement. We
You
have
almost
to do
need to
that.
have it.
To be
To
competitive.
get any,
We're saying we
Right.
have to.
anybody good, right?
Do we have any,
I don't know, but
I don't
sometimes
know,
it's
this is just sort of a out there thing, but is there any opportunity for any kind of loan forgiveness or loan repayment support? Because I know might be another way to catch some folks who might have large loans, maybe that they're looking to
everybody,
Yeah,
every
every.
student is gonna have.
That's what I'm
But I will also tell you that you're unlikely to get somebody with that kind of loan to step up to take
To
this
step
kind
up
of business
and
at
do
this
that.
time. Like, it's not going to be a position for a newly graduated physician.
Well,
Plus, we want somebody.
5 years
Yeah.
About
practice.
Yeah.
They can pay off about a 10
Right.
Even after
in 5 years.
right? I mean,
No,
there's
we're
still a lot
we're
of
still
loans
paying.
left.
Yeah.
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 It's not gonna
there's
happen.
still a lot of loans.
This
Yeah,
year,
Dr.
help
Brown, I
finds
know
I mean-
what is
Your-
available as far as loan forgiveness,
$10 grant,
how those
open,
are worded.
they gave them $1 billion
Some scholarships are probably
to it.
probably more flexible than others.
Grand
But
med school paid for.
I forgot what I was going to say. I was going to respond to
mean,
Dr. Oden's.
I mean, maybe we make that a criteria that it's got to be a physician that's half-time or less employed, that they don't have a full-time position. I mean, that just stated outright, because what we're looking for is somebody that can dedicate that time.
I feel like we have to see what we get,
Fair enough. I don't disagree with you, but
and
I
then
mean, I guess it would be a good point maybe to just say if they're
Yeah.
applying, but I mean, yeah.
right.
we're going to interview them.
Yeah.
Absolutely.
I mean,
Fair enough.
yeah,
We'll all be there to
all the
interview them.
questions.
Fair enough.
yeah.
So these are the things that we have to go through.
Yeah.
For me, I think with a full-time benefit and pay, I would think this is a dream
Yeah.
So
in terms of commitment comparatively to.
it could fit right into so many physicians
Yeah.
at this period of 5+ years into
Right.
Yeah.
and attract somebody like
Exactly.
Babcock ran you.
We'll never get one like
I
her.
can't-
Dr. Stamp is never going
14 years, but when he talked
Do not-
about it, he'd mentioned and said, so yeah, it was a good fit.
Yeah.
He said, heck yeah, just don't talk to me. And then 7 years later, it's my turn to join you. So yeah, whatever. It's a good idea. I like it. It's realistic.
So are we,
Motion to approve.
motion, the way that it is? You're
I
good?
mean, might as well.
Okay, so,
Does anybody have any questions about the reappropriations and how, because it kind of is all the job description, the 144 to set the salary, and then the reappropriations to create that available in salaries? Did anybody have any other questions?
Both of those together, or are we approving the job description and the appropriations separate, or does it all go together?
That's a good question. I thought it was just the job description.
I thought it was the job description,
Yeah.
right? Then you're gonna bring up the different appropriations, or?
Yeah, so that's what we do when we go to, yeah, so we can do it separate here, is that what you mean?
Yes.
In the, yeah,
Because the way, where the funding is coming is changing.
exactly.
Right, which is
Yeah,
gonna,
let's make it a separate line item.
okay.
Can we do that?
It's always better when it's line item.
All right, so we have a motion to approve the health officer description and position by Dr. Osan. Yes.
Okay, Dr. Boxham,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Dr. Osan,
Yes.
thank you.
So, thank you all. The next, yeah, what's the,
it can't
tell
be
us,
yet.
so then you go to the council, we go to the commissioners, when can it be posted?
Yeah, so we go before the commissioners for our regular Health First Indiana updates on March the 12th. And so we will include this as an update to them at that meeting. And then we will be on the agenda for the council then. We'll request that for March the 26th, Tuesday, March the 26th.
And after that, it can be posted?
Yes. Yes. As long as they approve that evening, then we can post the next morning.
Unless you have somebody who's a zealot that tries to get ahead of the curve.
And we put it in a pile until
You guys are cracking me up.
Any further questions? All right. Thank you. So claims and receipts should have come along? Did you get everybody, Carrie? I don't know if Dr. Fleming got it. Did you get the claims and receipts, Dr. Fleming?
No, he needs it.
I
We need.
didn't
okay.
get.
He signed his
the,
own personal one.
Oh, well,
Yeah, I signed off on myself. I did
There you
that.
go.
But
Helpful.
they give me
I mean, that's all the signature we need, just you.
That's it. Sign it.
in my
And if we
life,
can have a motion to approve our claims and receipts?
we were gonna do
We have a
I will
motion.
move to
Thank-
approve the claims and receipts.
Second.
One or
Dr. Boxham,
Yes.
second.
Dr. Brunt,
It's-
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Dr. Osan,
Yes.
thank you.
Thank you. We'll move on to the reports of committee staff and health officer. I'll let you choose your order of,
Well, we have a lot of visitors tonight
yeah,
surrounding the room, and then we've got
I noticed that.
so we asked the staff to all come tonight, everyone who was available. And we know that you guys have met Carrie and you've met Chris a lot, and Dan and Susie and Jeff. And Jess, our supervisors, but we wanted an opportunity. We have a lot of new board members over the last year and a half, and then we also have a lot of new staff. So we wanted to take time for each supervisor to introduce their staff, and just kind of let you know about how long everybody's been here, and anything else you guys want to add, supervisors. And Kendra is not here this evening. Our office manager, and you met her last week. She wasn't able to be here, so I'll have Chris introduce her staff, and they'll go last because Lisa is here. We've talked about her a lot, our vital records specialist, and she has a little presentation for you. So we will let Chris go last, and then introduce her last, and then you guys will love it. So, Jess, go
Do
ahead.
we need to pass around the microphone?
Oh,
Oh, I'm pretty loud. Can you hear me?
everybody's got to ask Jess.
This is my STI nurse, Amy. Kelly. She's in charge of the community's STIs, treatment, testing, all that. She has been here for a year. Yeah. This is my very newest nurse, Heather. She's been here for 2 weeks.
Woohoo!
Welcome.
Welcome.
And she's like,
And she came up for phlebotomy training
Did,
the week before she started.
we completed phlebotomy training again like 2 weeks ago, so everybody's up to date. We're all good. I'm hoping that she will help with our maternal and child health programs because she has a background in that. So, and then this is Shannon. She's been here for 2 months, and she is taking my place as the epi nurse. So she'll be investigating our communicable diseases.
Thank you.
No?
We appreciate
Welcome.
Thank you.
Yeah. They-
Is it true that syphilis is on the rise?
It is very true.
400% increase, right? In Indiana.
Crazy.
For my syphilis data.
I thought you were,
It was a rhetorical question.
I appreciated the smile with, she's our STI nurse. Infectious disease person. Good role.
Need them all.
You should hear what we say at the office.
I,
We can imagine.
Great minds.
And you guys know Carrie, the care coordinator, and Chris is. So these new positions that we've developed for Health First Indiana, they just really have come in and taken off with them, and
Yes.
I'm so impressed with kind of working together, the job description that we made, and just taking it and running with it. So I just couldn't ask for more, and it's been amazing. So I appreciate you guys. Dan, introduce you. Oh, did you? Go ahead.
I have two staff. I hired both of them. Zachary Martin could not be here tonight. He's been here almost 2.5 years. We hired him in October 2 years ago. So he's an environmental health specialist, septic wells, tattoos. And then I also have Shelby South over here. She's been with us over a year, a little over a year. She's picked up on everything. She also has been assisting foods. Foods was shorthanded at the time, and one of our previous employees knew foods and environmental. So part of when we brought her on, she also trained with foods to just help them in their busy time when they have festivals and weekend things and stuff like that. But she's predominantly an environmental inspector.
Thank you.
thank you.
Susie, foods.
Yes, Emery and I have both been introduced at Board of Health meetings years ago, so we're the oldies but goodies. This is Emery. This is Emery Kostelnik. Started in August 2019. I started in September 2018. So we're the experienced one.
Veterans.
So and he
There
definitely
you go.
does all our coordination for all our temporary events and lots of other stuff. Plan review, all kinds of things. So that is really great. And then the next one hired, we were so happy to have Mandy, was hired in June of 2022 as our secretary, and she handles foods and environmental very well. She does all our smiling customer service, and she just went to full time in
Yay.
January. We're so excited to have her here every day of the week. So, and then next we hired Antonio Turner. This is Antonio over here. He is great. He also just went to full time. I'm so excited to have 4 full-time inspectors. We have so many establishments now.
Mm-hmm.
We have so many temporary events, and we all do extra things. So, and also Antonio just got his Bachelor's of Science in Addictions Counseling. which is
Very
so
good.
exciting.
Well done.
So, yeah, we're really glad. So glad to have him on board. Then just last October, we hired Carrie Batson. We're so glad she spent some time out west, but now she's back home in Indiana, right? And we are just thrilled to have her on board right now, another full-time inspector. And last but not least, January 29th, we hired Noah Weber. So Noah, just started with us. He's in the midst of training. He's been shadowing us, but he's really right on the edge. shadowing him in inspections, and then after that round, send him off on his own. So, but everything's going really well with that. So, thank you.
Thank you.
I just
Thank you.
mentioned that at IDOH they have like state foods representatives, so they inspect the restaurants just like we do, but the ones that are on state properties. And our inspector, they're five different. They're not the districts; they have larger regions. So Donna Walker has been the IDOH counterpart of us for years, since right after Susie and I started, and she also does some produce inspections and things like that. But they are all in the middle of getting standardized as inspectors by the FDA. So Donna chose Porter County to do her standardization in. And so Donna and the FDA have been here for 2 weeks and with one of our inspectors going out and doing those inspections. And so just
A little bit in January, a little bit in February, and she passed.
She
so
did.
We were very, very glad
That's for sure.
about that.
thank you guys so much for your division.
Like,
And
nervous for them.
We just want to forget to mention Shelby.
Jacob.
Shelby, I mean, again, Dan already touched on that she does. But we are
Like
so
hide.
happy.
Yeah, I
we've
hung up
already talked
with
to
Steve
Sabrina and
last
had
week.
a
I was like,
meeting
oh,
with Porter County
don't talk to
Fair,
me.
the
You won't see me. Don't talk.
That's a lot of
Right.
work.
Yeah. Yeah.
Hide.
Yeah.
People might come in.
So we've already
I'm outta
been,
here.
Yeah.
talking
Over
with
there.
her and talking to people. I think people have already tried to buy their permits.
Good.
So that's kind of how it goes. So anyway, but we're all glad to be here.
Thank you.
You.
you guys have met Jeff and John, our emergency preparedness coordinator and deputy. And then Chris, if you don't mind introducing.
I'll introduce Mandy again, because again, she's not clerical, but she works for Foods and Environmental. So we have Stephanie, who basically is grown up in the health department. She's been here for 20-some years.
Oh,
And,
wow.
Stephanie pretty much knows a little bit, not a little bit, a lot, but she can handle anything we throw at her. She can back up separate divisions, so she is a tremendous help. She'll help
Wonderful.
with the billing, wherever needed. Shelley has also been here for about 20 years.
Wow.
She's in vital records and was in nursing at one time, so she does both also. And then, of course, we have Lisa, who is just started with the billing specialist, but will still continue to do the statistical information for Dr. Stamp for vital records.
Thank you.
And on that note, as we have changed the way that we're reporting on cause of death, Lisa has prepared some information, kind of ways she can show you that if you have questions on any of those categories, you can get a hold of her, and she just kind of wants to show you what she can do with that information, how she can break them down, show them graphically, and things like that. So, do you want to come up here, or? So tell them what line item you have.
Okay, so it was just a breakdown now of what we can do now. Previously, I started here full-time 2021 in November, and I started in Vital Records. And at that point, we were doing kind of a tally sheet and then inputting that into a PDF kind of form. Indiana State Health Department started with a new system called Drive, I believe in 2020, which I love because you can do a lot of different things with it. So over the next 2 years, I progressed to electronically producing some data from their systems. And last year we did a lot on suicides and accidents where I could break down. So starting this new year, Dr. Sump and myself got together and thought we'd try and revamp the reports that we get each month. So now what we did, we've broken down into categories, and the information I can bring in, I can break down now deaths by ages and gender. So for this month, this is the January, that's the amount of deaths we had, and then they're all broken down in ages and genders there. So minutes, hours, and days, you can see we had a total of 3 deaths, and all of those were male. That's correct, yeah. We had no one in the 0 to 10 years, 11 to 19 years. And then ages 20 to 29, there was a total of 1 death in January, and again, that was a male. And so on, 30 to 39, a total of 3, 2 male, 1 female. 40s to 49 is 6, majority of male 5 and the female was 1. So we did this all the way up to 19 over. So the next slide will give you the.
Excuse me, what does minutes, hours, days mean?
That's if a child takes a breath.
Newborn.
Gotcha.
Classed as a death certificate. So if they can live for a minute, an hour, a day.
Gotcha.
Yeah, the system I have to break down like that, because if I put it as 0 to 10, it won't bring those in. So we have to break it down even further into those if you want the full. So we go 50 to 59, 60 to 69, 70 to 79, 80s and 90s and over. So all of those together will give you the total breakdown of the deaths in January. So we can break them down there. Yep. So on the new report you've got, we changed all the new data that we're collecting, and one of them was circulatory system.
Yeah.
Which was, I think, said 75 for the January month.
Yes.
I think that's what's.
So within that now, we've done subcategories. So our lovely Jess here does that for us.
Mhm.
All the information in. So it highlights everything that's natural death, suicides and all that are on a different setting. And lovely Jess goes in here and does a click system for me. So she'll put it into the first category, and then she'll move into the subcategory, which is the breakdown of these. So on the breakdown of these, we can see how many within the circulatory system. We had just over, I think it's 37. It was heart disease, pulmonary heart disease categories, other forms of heart disease. So it then breaks it down then within there for those.
Would congestive heart failure fall under other forms of heart disease?
It does.
Yeah. Okay.
Other.
Okay.
Well,
Jess is learning it well.
Yeah, we're working
We see
together.
that diagnosis a lot.
I bet you do.
I can also work with Jess if she
Yes.
wanted today, neoplasm.
Yeah, sure.
In the cancer of the blood wasn't actually in the list.
Right.
So I can just go in, okay, I'll add that category there for you as well. So we can work adding categories if they're not completely what they want. So
I hate to break it to you, but CHF is no longer an acceptable diagnosis.
No, I know. But I'm just wondering what other form of heart disease that would have that high of amount would be.
Yeah.
And again, within that, there's a third section on the sheet, if you would like, that says where it says other form or other, then you can write a description of what that other is. So we can then, if we get a lot of those in certain areas, we can then go and break those down as well. To look at that.
Yeah, I mean,
I'd like to do them. So then the next one is still within the circulatory system. So we then just broke it down again within the subcategories of gender breakdown. So you can see male and females within those subcategories.
Interesting.
And then the one after that I broke down again is male breakdown by age ranges, female breakdown by age ranges. So again, do this within all categories. If you want to look at something, just give me a little bit of time, a day or so I can break them for you. And then just an extra one on there is just a tobacco use that it's suggested within those on there. So anything that's on the death certificate, the majority of it, we brought most of it in. We can look at areas. So, we can look at facilities where it happened, whether it was home, certain facilities. We can look at places where it happened, their residency areas.
Would it be helpful to do zip codes?
Yeah, it does have zip codes. So I brought in
Exactly.
So it'll have the county. It'll have the county because some people pass here that aren't actually a resident in our county. So we have that. So it'll have the residential address with the zip codes as well, and the cities where they're on. So it's sort of similar to suicides and accidents and drug overdoses, and that we can break down into specific areas. Certain.
I think that would be nice. I mean, our county is so different between suburban and rural and things of that nature, and to know like what happens in Portage versus a township versus Valpo, I think would be great.
Yeah. So
you can plug that in and
especially if it's drug related.
Huh?
Drug related.
Yeah.
That's
Yeah, that's a category too. I know. Yeah.
So this, at the minute, it's just cause of death. I have
demographic.
in, and I do suicides. Look at suicides, and then accidental deaths, which includes drug deaths as well. Which I then the accidents all come as one on a death when they tick them. They don't. So I have to go in and I categorize them, whether it was traffic, whether it was drug, whether it was drowning,
gunshot.
Yeah. So say in this coming up to this summer coming up, we can look back and see how many drowning deaths we've had over the last couple of years, and then we can also look into where that happened. Is it a certain section of the beach?
Right.
And the age groups as
A
well.
pool, a beach, a bathtub. You know, these are all very different interventions.
Yeah.
And the same with the drugs overdose. Again, with these, we can break down male, female, age ranges, specific areas, whether it's, you know, a lot are in Valpo, a lot are in Portage, zip codes, out codes. Did it happen at home? Did it happen somewhere else? So we can look at a lot of different kind of ranges and areas when I'm asked. So, yes, that's me.
This is
I've seen your work over the course of the last few months because I've asked with Dr. Stamp, so
And I've brought some of it.
Yeah.
to the board before.
Yes, you
just
have
as
the
a
suicides and things, and
over.
this is the kind of stuff that we're going to need to know if the changes that we're making. I know some of these are going to be generational. We're not going to see some of these things in the short term, but you know, this is the kind of stuff we have to follow. This is important for us to know.
So, as I said, this is an example, and this is just on the deaths. I also starting to help Haley with the FEMA, so we can look at birth.
FEMA is good, yeah.
Yeah. How many prenatal visits do you have? Postnatal visits, areas where the weight of the child when it was born, and you know, if they tobacco use before or after. So a lot of this information can be used for a lot of different.
And it's very time consuming.
Oh, yeah.
All of this.
As I
You
say.
know, so I really appreciate it.
Read from it. If you please tell me what you want, I can write it all down, see if I can do it. Just give me a couple of days to get it all together.
Because especially now, since mental disorders, FO1
Yes.
99, that is such a large category because that's mental, behavioral, neurodevelopmental, and neurocognitive disorders.
Yes.
All within that bunch, right? And so obviously dementia is a very differentiated thing from another kind of behavioral or neurodevelopmental disorder. And so that would be, you know,
Good to know.
really important to know, right? Like how many of those are actually in the dementia category.
Yep, that can easily.
Well, that said, we could even, so on the report that you receive every month, we could, if there are specific areas of the system that you would like to have reported on. So if you would like dementia broken down, we probably could do that, but we'd have to pick and choose a little bit,
I think
just
these
because
ones- I
it
think
can
these
be
ones with the big
cumbersome.
numbers, the mental disorders, the neoplasms, the ones with the higher numbers. I would like to know how many are colon cancer versus lung cancer.
What I can do
you know.
with that is I can also it won't be
Sorry.
in there, but
More lung.
what-
Oh, I know.
What I can do is provide the subcategories as well with that. It's about, I think, 6 or 7 pages. So it's the subcategories behind those, and then it'll give you the tally for that month of how many within each of that. And then if there's ever, you see a high one within the subcategory, you want to look
Reach
at
out.
the next board meeting, and I can go in and break that down then to this kind of level for you.
Yeah.
We
I
might-
provide them once a month with the
we might not want to put every like the subcategories that
the
have,
highest for the month.
Yeah, high, like 20 and above, 15 or above, something like that.
well, I'm talking about the subcategories
Yeah.
too, so some won't have any in them.
Right.
Maybe if it's, 5 or fewer, say you're breaking down circulatory system, and, there's only, I don't know, one pulmonary, arterial kind of PE type thing, whatever. We might not want to put that in every month or
Right.
whatever as a subcategory.
If you want to say pick a number, if like the month, if your first category theirs are above a certain level, then we want to look at the subcategories to those. So if
Maybe 15.
if
Is that fair?
15 for the month, then
Something
you want to look at the subcategories and the second categories.
Yeah.
There would only be 4.
There would only be
Right.
4 then, yeah.
That wouldn't be cumbersome. Or not, I'm sorry, I shouldn't say that at all. That should, sorry, Lisa.
Doing that's fine because I've set it to automatically fill. So once
So it auto-
Lovely hair's done hers, it autofills that and it autofills the subcategories.
And then if you see a sudden change in something.
Yes.
This is the kind of things that we would want to know too. If there's all of a sudden an increase of some sort of, thing that we need to be made aware of.
Or even
No.
considering seasonal, for example,
Mhm.
with suicide, with infectious disease, with increase.
Accident,
Seasonal,
injury.
That's usually
Well,
how things
yeah,
are
cardiovascular.
reported.
Yeah. Because what you
Stress.
you will now start to notice each month you get the report. Before, where it was pending coroner, it was just totaling for the year because we didn't go back. Now it's real time. I go in and I change when they've come back through. I can go in and look and change them to whether they're whatever. So I believe the one you've got there is out of date because I updated it. That was done Friday. Updated again Monday. So there's 0 now pending for January. And I believe 2 of them have gone to suicide. So suicide's actually a bit more higher than what it is that you've got now. So it's
Yeah.
more in real time kind of thing that
We appreciate it.
look at it. Thank you. For you. Okay.
Thank you.
We appreciate it very much. Thank you. Thank you, Jess, for your work too.
Oh, yeah. Thanks, Dr. Stamp, for her patience.
Thank you for being willing to do this. Let me just add more to your plate, Jess. Yeah.
I'll be all right.
Sorry. I just have a couple other less fun things. So this report for the maintenance and trust fund that you received as well for information. So these are the funds that were the legacy funds. So starting in 2024, we no longer receive funds into these accounts. But previously, each year, each county would be notified of how much they were going to get into each account, and then they would be responsible for budgeting that money. And Connie did that historically. So Connie would budget for whatever we were given in 2023, and then as well, if there was any money left over from previous years, we could request those as additional and get those approved. And once that was approved and the budget was approved, then that was what you guys would see as those funds on our budgets for total approval. So the 2023 maintenance and trust budgets were approved by the board, probably in the fall, early fall of 2022. And so then at the end of the year, then we must report on them. So basically they tell us this is what was approved. We have to go in and fill out the spreadsheet and say, okay, this is what we spent in each of these line items. And then we have to report how much is remaining in the account. So that's the letter that you see here. We reported on what we spent. We didn't spend quite all that was budgeted. And the amounts are the amounts that are remaining in those accounts. And we have appropriated and been approved by the board to try to spend those down as close to 0 as possible in 2024. That is what the state wants us to do. They prefer that we kind of get
Close
off the
out.
books, yeah, and close those out. We might still have a little bit left over for 2025, and that's fine. But we received the information to report after the last board meeting, and then it was actually due back to the state by February the 29th. And so we did go ahead and do that reporting, but you'll see on here, you know, I did have to contact Dr. Boxham, and we talked to Dave. Dr. Stamp had to sign it, and he had let us know that we could go ahead and complete that for the state and then have it ratified by the board. So does anybody have any questions about that report or those funds or that process or anything? No. And then I don't know if the ratification has to take place by vote.
Well, let's do it to cover our bases. So I will present a motion to approve the ratification of this
Second.
amendment fund.
Dr. Boxon?
Yes.
Dr. Brunt?
Yes.
Dr. Fleming?
Yes.
Robin?
Yes.
Dr. Osan?
Yes.
Thank you. Thank you, Carrie.
You're welcome. And then the other thing, before we get really quick to Health First Indiana updates, that I wanted, the letter on the Porter County Health Department letterhead that you all have, is the letter that we have submitted to the council to get onto the agenda for March the 26th. So there are a couple of things going on there. And the first one is we have received for the budget period that started July 1st, 2023 through June 30th, 2024, we have 2 different immunization grants. So one of them we've historically received and we will continue to receive. We don't know at what this year, we'll let you know, but the other one is the COVID immunization grant, and that is ending. So we are in our very last ever budget period of that, and it is over on June the 30th of 2024. Right after the first of the year, they reached out to every county health department to let them know, hey, this is how much you were awarded, this is how much you've spent, this is what's left. Anything remaining unspent is going to go back to the CDC. what can you do to, utilize the rest of the money that you were awarded, because it's all reimbursable. So one of the things that they have asked us to do is look at all of our equipment, so like our vaccine storage equipment, log tags, and by the end of 2025, we're supposed to have replaced anything that's 7 years or older and also gone to a cloud-based log tag system. So because we're going to have extra money left in there, we're going to reappropriate, or we would like to reappropriate funds in that COVID immunization grant fund in order to cover those things. So we just are moving things around from the way that they were appropriated so that we can utilize the most of the funds. So that's what this first form is for, the request for transfer of appropriation 8911.
And you said that if not used goes back
To the
June
CDC.
30th?
It goes back to CDC. Anything that's not used, yeah.
And forgive me for my ignorance.
Yeah.
Is this just for COVID vaccine, or is this for all of our equipment?
All.
Perfect, okay.
And then,
Do you want us to have?
yes, let's vote on that. I apologize.
So I propose a motion to approve the request for transfer of the appropriated funds.
A second.
Okay. Dr. Boxell,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Dr. Rosan.
Yes.
Thank you.
And then the second request for transfer appropriation is out of the local public health services fund, not out of, within the local public health services fund. And this is to put the money into salaries, into FICA, PERF, the fringe, and medical and life insurance for the new health officer position. So you will see that those appropriations are coming from various places to go into the line items where they're needed to cover what you see represented on the 144 form, set the salary. And again, that's an up to salary, and so we'll advertise it at full-time and at that rate, and then we'll kind of see what applications we get, things from there. Does anybody have any questions about those things?
So if we were to hire someone not at the top of the salary, does that change the level of appropriations then?
Yes.
I mean, that would have to be adjusted
So the appropriations would still stand unless we went and readjusted
unless
them.
we reach, so say we
Yes.
hired a person at halftime
Right.
with half of the salary, would we have to change that?
If we needed it in another
If we need it,
location,
okay.
yes.
Out of curiosity, and I apologize, I don't know the number off the top of my head. What are we looking at total between salary and benefits that's going to cost us?
Salary 150?
Maybe.
Yeah,
150, I believe, was the salary.
That's what I want to know.
right. And then the PERF is 11.2% of the salary. FICA is 7.65% of the salary, and then medical benefits are 21 and some change.
So we're looking at
Thousands.
200,
Mhm.
about on par for a full-time position.
I think so.
Yeah,
With no call.
with no call, yeah.
To me, it's a dream.
I was gonna say, find a whole list of doctors that might want to.
I might want to quit my job.
I know, same, I get it.
Especially this month. Get the word out.
Run it by.
My husband might
seems
disagree with me.
interesting, and then they kind of aren't sure. So it's nice if it is more appealing. It's just hard.
I think it's fair.
Oh, it is.
Yeah.
Actually,
Yeah.
it's like at first you're not sure, and the more they would read through or discuss it, the more interested they became. And that's how you get quality people to come.
Plus, who wouldn't want to work with these great people?
I know, right?
I know.
That's gracious.
Still have a
Yes,
part-time
yeah.
job if you wanted.
Yeah, they should pay us.
Right. We're working it.
So do we have to make a motion to?
To approve this as well. So what were we entitling this? A motion to approve?
So we have the 144 for the salary rate, and then we have the appropriation. So I do them separately, the reappropriations. and
So I,
1161 first.
which is the salary?
That would be the reappropriation.
The real-
Go ahead and do that, yeah.
So I will make a motion to reappropriate the salary.
Second.
Okay. Dr. Boxell,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Dr. Rosan.
Yes.
Thank you.
And then a motion to approve, is it like the benefits package,
It
basically?
would be to set the salary.
Just to set the salary and benefits.
Motion to approve.
Very good.
Dr. Thompson?
Yes.
Dr. Brunt?
Yes.
Dr. Fleming?
Yes.
Robin?
Yes.
Dr. Rosan?
Yes.
Thank you.
Thank you. What else you got for us?
I'll just do a real quick health for Indiana.
No, this is the fun stuff.
Find help.
Yeah.
So on the find help button, and I may defer to Carrie, but I just kind of wanted to show you some of the updates and what they've got going on. Whoops. Oh, I did. It was in there. Fine. Sorry. All right. So they have all the categories that were selected by the Community
There we
Resource
are.
Network are all live. Along
Very
with
good.
all the subcategories.
Nice.
So I don't, the numbers of programs are growing a little bit. Every time I see it, there are a few more. So Carrie is really working on different organizations, getting them to get in and claim their page and update their page. She has a great email that explains how to list out all of your services so that you can appear in all the appropriate searches. It's really a great email. And then also, if she can't find someone in there, then she recommends them and then explains to them how the process to go through that. So it is really time consuming. So she's chipping away at it. And then the whole Community Resource Network then is working on this kind of all together. Now the next step is to get featured partners. So if you want to talk a little bit about that.
So the next step will be you can define if someone is a community, a network member. And so Sanford, the police social worker, has this community resource network group where about 50 people attend every month. And so they will be helping us tackle and identify programs that need to be claimed, getting them added. And so those that are responsive and really committed to this will be identified as a network member. So those of us that are going to the site and looking for those resources, we know that those individuals or those organizations are committed, they're responsive, and so that would be likely someone you would refer to. I did have a situation where one of the organizations on there wasn't very responsive. We'll also be able to filter out some of the more national programs. If we're not sure they're legit, we may be able to hide them from our page. So that is our next step. And then really then we'll be creating favorites for teens, senior citizens, and then those will be tabs you can go to just for that particular age group or that group to find.
Do you have any questions about that?
Very good.
What are we doing for like advertising for this? I know I know we were gonna like put stuff on Facebook and do we have like cards or anything that we can pass out or leave at like doctor's offices for people that maybe aren't online? This is just something that I wasn't sure if that was being done, like thought of or not.
Yeah, no, that's a great question.
So we are thinking about that. We wanted to get the navigation bar set in place. We want to get our network members identified, and then we'll look at really doing a big press release. We have ordered pens that have the Find Health logo, bar logo, and the website on it, so we'll be able to hand those out. I recently have a Facebook page that I use to post on Park County suicide awareness and prevention. It was challenging for me to join some of the Neighbors Helping Neighbors group, happenings and things like that because I haven't had a page for 6 months. I got rejected, and so some of those that I have been approved, and actually today I started posting. If you're looking for resources in Porter County, visit this website. There's over 2,000 programs listed. If you see a program that's not listed that you know is available, please help us in suggesting this program. And you can go to the very bottom of the right, and anybody can suggest it. So it doesn't have to be an organization, but I definitely would like to get some cards going. So I'm quick to want to get that out there and do a press release
Can I make a quick suggestion? It would be an unbelievable resource to have a QR code that people can scan.
That's why I was saying like a card or something.
Right, like on the card, on the poster. If I, in my office, if I could have a poster just say, scan that QR code. I mean, that's ideal. Perfect.
Yeah, I'd like to put in the libraries, because there's many people who don't have access to internet or phone that go to the library to use it. So if there was a little poster or something, they could, even know it exists. Like you said, just the more outreach we can do for folks who may not be technically savvy. And QR codes are awesome, right? That's great. And then also just, sending it out to schools or libraries just as much as we can.
That's a great idea. Not as familiar with QR codes, while I can create them, so my mind tends to not go there, but I will get that created. I sat down with the library person to help her get her programs added, because the library programs weren't added, and really sat down and discussed with her, like, the steps she can take in getting things on there, and so I think they'll be very open, they're very willing to promote this.
The reason why I think the QR code's a good idea is because if you're on a website like Facebook or whatever, you can click the link, but if you don't have the link to click and that find help button's no help in the real world, when you don't already have a website in front of you.
Yeah, it's easy access.
Right.
And I imagine all these community partners are going to be involved in promoting this as well. These 50 community partners
Right.
and such will be part of the whole network of systems to promote.
Right, so some of the bigger companies are reluctant to put it on their page, but they've offered to put it in their newsletter or post it on Facebook, so it'll depend on each company and,
Is there
smaller
local?
organizations where they don't have to go higher up, it'll be easier.
Put it everywhere.
Whatever. Yes.
No problem.
Yeah.
Now, I understand the board members all were recently given portercounty.org email addresses, right?
We were given the opportunity to create one.
So if you have a new porterco.org email address and want to put the button, have you all figured out how to?
No, I have not.
I haven't figured out how to put the button.
A month to figure out how to
So-
create the email.
Right, much less a signature line, right? So maybe Carrie or Demetrius or somebody, if you could send, including me,
Yeah.
to our porterco.org emails, instructions on how to add the find help button to our signature lines.
Yes.
Maybe we need instructions on how to do a signature line or a signature block. I don't
Yes.
know. Then when we're responding to emails,
Yeah, that's perfect.
we will have that also. Thank you.
Thank you.
No problem.
All right, going back here to home, we will click into the Health First Indiana, and I just want to show you the things that are updated. We say go to the same pages. So on that page 13 of the strategic plan, I've just kind of highlighted some really exciting things here. So on our youth health fair, it is June the 14th, and I know that we've had that on here. We have over 40 vendors committed to be at the youth health fair.
So amazing.
Very exciting.
Yes.
So we have sports physicals that are going to be taking place, and so we're kind of working out appointments, setting up for that. The Zach Mago youth cardiac screenings. At the same time, there are going to be haircuts. So Demetrius has found a school in Lake County that is going to come and do some haircuts, vision screenings, dental screenings. The Boy Scouts are going to be there. The Girl Scouts are going to be there. So many other people. We have a DJ that's going to be sponsored by Northwest Health. We have some
Face painting.
face painting, a photo booth. I know Community St. Mary's is helping us out with the Ecotex for the Zach Mago. So yeah, HealthLink is being represented. Associated Peds is being represented. I think we're talking to North Shore. Yes, HealthLink. So it's
Amazing.
very, very, very exciting.
Yes.
Our hope is for good weather, so please, everybody, hope for good weather, because we really would like to be able to expand out into the grass and allow the Boy Scouts to be over there with the tent set up, and I know Valpo Youth Soccer is going to be there. They could be playing soccer. You know, we just really, and we're asking everyone to have something interactive, games, activities, things like that for kids of all ages. So, and I'm sure that I've missed lots of people, but we're very excited. So if you're able, I know it's on a Friday, and
We'll be here.
but if you have any questions, let us know. And then we
I know.
did use a company called Digital Alliance. We are making promotional videos with them. And we had our video shoot last Wednesday on the 28th. And so we did our interviews, and they were here all day. It was quite the production. And we are waiting to see what they send back to us. They have given us the scripts and allow us, if we want to look through and pick out some sound bites that we definitely want to be in. Otherwise, they'll put some things together and send them for us to review. So that's a 4-minute video, right, Demetrius? A large
2 to 3 minute. Yep.
2 to 3.
Oh, the whole thing is
whole health department.
3 minutes?
Yes.
That's just the about it.
Okay. Oh, God.
And then they're
I want 15 seconds.
vignettes, like small vignettes about specific things that we picked out. And then from the larger video, they're going to do a little video, and that's what we'll use to promote, like on apps and things like that, that we can send out for those 30-second spots. So we're excited about that ish.
Yeah.
Just replaying in my head, you know, everything.
Yes. Oy.
So just a couple things. The public health.
There's no glam.
We're still waiting on quotes for those, so we'll keep you updated. For CPR training, John is trained as a trainer, so we're wanting to get one of the other nurses trained, and then we'll be able to offer trainings, like we'll open those classes up, and so that's what we're waiting on there. Diapers through the Indiana Food Bank, or the Food Bank of Northwest Indiana. The food pantries received their first diapers, wipes, and sanitary napkins.
Very good.
Yesterday, so it's very exciting. And then we also are going to go pick ours up from Hilltop, so we will have a supply here as well for people that are referred here to come and get those things. So we are very excited about that. Also on the bicycle program, we met with Leo's Mobile Bike Service, and he was very excited to be a vendor for us for that. And he has a few different sources for bikes. And so we are kind of working with him, and we can work with him in different capacities. So he's got some single speed cruisers that he got from another source that he's going to give us a really good deal on if we want to start there. He has used bikes that come through, so we can, purchase used bikes based on, how they were given to him, or if it was a donation, he'll donate it and tune it up. And then he also is a source for new bikes, so he can order those for us and work with us on that. So we're very excited about that and excited to get that up and running. So we'll keep you updated. And then basically things have just kind of moved around. So we have the things that have been published for 30 days, where we're working through the contract execution and things like that. So those things are all listed there. Of course, we heard from the Porter County Sheriff's Department today, and so that will become published now for the 30 days, and we will kind of move through things from there. I did start my email to the retail food establishments today, so hopefully we'll get that out to them to let them know, hey, we're going to have something out for proposal if you guys would like to submit a proposal to be one of the restaurants to partner with us and Purdue Extension for those healthy menu items. So we're going to kind of get that rolling. Does anybody have any questions?
Amazing.
Does anybody have anything to add that I missed? Okay, that's it.
All right.
Yeah?
You're not going to talk about us going downstate?
Oh my goodness, I meant to bring the posters up.
You should have, yes.
So Thursday,
Tell them what you did.
February the 22nd.
Really, it was amazing.
Was Public Health Day at the State House. And of course, this was not a budget year, but they're in session down there. And so the idea, Sheila reached out to us and asked if we'd be willing to have a table as the Porter County Health Department to let them know what we are doing here in Porter County. And so we were one of 3 health departments that had a table.
From the whole state.
Carrie and Jess worked really hard. We had lights, and we really were a hit. We were really a hit. People came around. We talked to a lot of different health departments. We talked to a lot of different community partners, divisions at IDOH, about what we're doing. We had sent emails to all of our representative senators in our area, and Representative Mosley came to see us, Senator Charbonneau came to see us. We received some other emails. They were in session, so they really had to make time to run out and come and see us, but it was very nice. And it was just great.
It was amazing. I mean, the amount of people, so, you know, this was an entire state health department event, so the amount of people that were there, as you can imagine, was quite large. The amount of people that came to our table to ask them, you know, how we've been so successful, looking at all the plans and programs that we've had. I mean, people were just very impressed. Senator Charbonneau received an award from Dr. Weaver for his writing of the bill for our funding, so that's our county as well. So it was just, for me, I was extremely proud to be there and see, you know, what you guys have done and how well it's received and how we are leaders amongst the state, and everyone was impressed, and I'm impressed with you guys. So that was really impressive. I'm proud of you.
And we had a lot of reshares of our posts on Facebook from our community partners, and a couple of them have asked to go down with us next year. They would like to be there with us next year to support us at Public Health Day, and next year will be really big because it'll be a budget year, so they'll really be packing to stay out. So we're excited about that. Thank you.
Well done. All right.
Okay. Yeah, there's been so much talk.
No.
I don't have a whole lot to add, but I do want to make mention of the measles case that was in Lake County. 2 weeks ago, we were notified that there had been a measles case in Lake County, the Gary area, in a young person who had a little bit of actually a delay in diagnosis. They had traveled within the United States. I believe it was to Florida, and there was some delay in getting the diagnosis. So it was fairly late that the diagnosis was made, which meant they had to look at more exposures in the area. So it did not affect Porter County, but because Porter County is right next door, we wanted to make sure that the word was out that not only are providers aware of the signs and symptoms of measles, so it can be identified quickly, but then how to go about getting testing done, because the State Department of Health, the Indiana Department of Health, does have to approve testing. So a provider needs to talk to the Department of Health to let them know what the symptoms are. You don't want to over-test, but if there is someone that meets criteria that they have concern about, their testing is available. And then get the word out to schools and to the community to let them know measles vaccines are available for all ages. If you were born after 1957, if you're born prior to 1957, you're considered immune. So.
All those people before spring break travel, if you have a little.
Right. Yes, it wasn't.
MMR, get that before you go down to Disney World.
Yeah, we generally see when there are measles outbreaks, they happen in areas where people are frequently traveling internationally. But now we're seeing it where even domestic travel can increase your risk of getting measles if you're not immune.
And a lot of times it is these kids who haven't had the chance to get their full vaccines yet. So, if your child, even just the one, what is it, 90-some%?
93%
with one. Yeah.
97% with two.
Yeah. Very good. All right. Any miscellaneous to add? Are we ready for public comment? Anyone? No public comment? Going once, going twice.
Really quick though, I forgot to bring up the remodel downstairs. I know that they had tried to submit something to the state. Mm-hmm. Did you guys get a letter back?
Thank you for asking. We did. Yes, we did. And so then we were able to give that information to Commissioner Regnance and the architect. And so he asked me for some further information, and we're going to be able to work backward in the schedule and then get back on track. So yes, we're approved to use
Awesome.
historical COVID immunization funds. So very exciting.
But it is pushed back a little bit, right? The bids are gonna go out later.
Yes, and the decision was kind of made to do that anyway, just because of the fact that putting it out to bid at July, starting after November or in November, that allows us more competitive bidding anyway.
Good.
And then we don't have the disruption of having to work the construction around 102A. Just like completely take that out of the equation. So yes, it's working out. So thank you for asking.
Yeah, no, I've been thinking about it, so I was like, oh, I didn't want to.
Sleep well tonight.
Yeah,
That's
I will.
correct.
No idea. We all should.
Yes, better.
One last call for public comment. If not, if we can have a motion to adjourn.
Motion.
Second.
Third.
All in favor, say aye.
Aye.
Aye. Thank you all. Boiler up.
Hey, thank you.
Sorry,
For all
Dr.
your help.
Osan.
What?
Guys, too long.